Today I'm joined by the lovely Dr. Shiromi, aka the Cloud GP. After working as a GP for more than 15 years, Dr. Shiromi developed a strong passion for helping patients with their mental health. She created the Cloud GP, an online platform providing access to timely mental health support and resources for people who may not be comfortable seeking professional help in person. The stigma around mental health still exists, and it can be so difficult to talk to someone or know what to do to support a friend or family member who's struggling. In this conversation, Dr. Shiromi shares her tips and advice if you're experiencing symptoms of mental illness yourself or you know someone who might be. Let's get into it. So, Dr. Shiromi, welcome to the podcast. Thank you so much for giving us your time today. I'm really excited to have you, and I'm keen to understand what is it that you actually do.
Yeah, thanks so much for having me. It's a pleasure to be here. So I'm an Australian GP and I'm also the CEO and founder of the Cloud GP. And the Cloud GP is an online mental health program for anyone who's been newly diagnosed with depression or anxiety. So it's a self-directed program that can be completed in a few days that goes through things like lifestyle interventions and practical psychology tips to get people feeling well and feeling better while they're waiting to see a psychologist.
Okay, amazing. And we have listeners from all around the world. Is this something that people who don't live in Australia can also access?
At the moment, unfortunately, it's only for our Aussies down under, but most certainly down the track, our hope is to expand it to other countries as well. The reason for that is mainly because we talk a lot about the Australian GP experience, and we talk a lot about crisis support networks and free resources within Australia. But once we start collecting all that information on an international level, that is most certainly the hope that we can expand this service to everywhere. I'm sure Australia isn't the only country that's a little bit under-resourced when it comes to mental health.
Absolutely. This is amazing. So tell me how you came up with the idea.
Yeah, so effectively, I've been doing everyday GP or general practice or family physician for our overseas listeners for the past 10, 15 years, and I love general practice. And over that time, I developed a real passion for early intervention mental health. So getting people coming in to see us as soon as the cracks are appearing. All too often in GP land, we see people present for their mental health and their well-being when they're almost at crisis point, right? So when their relationship is on the rocks, or maybe when they're about to lose their job and they've come in a last minute scramble. And I've often found myself thinking, gosh, I wish this person could come in early. I wish they'd come in early and we could have started the ball rolling with helping them, manage those symptoms and those feelings. And so I think, with the under-resourced system, especially here in Australia, we need to think of out-of-the-box ideas to help work with general practice. So work, alongside that traditional model of seeing a person in face-to-face sort of consultation to empower patients to learn skills in a self-directed model, which they can do in the comfort of their living room, in their time and space. There's so much, and, that you can learn by yourself with, trusted professional support. That doesn't most certainly negate the need for that one-to-one care and consultation. When it comes to mental health or treating depression or anxiety, we are never treating depression and anxiety. We're looking after you, the person, and that comes with, individual aspects and unique circumstances. So that's most certainly very important. But our program is about giving you the skills and know-how so that you can start feeling better while you're waiting to see the psychologist. You can start making those evidence-based lifestyle changes in diet, exercise, and sleep. Start learning how to meditate, learning how to, start thinking about the way you view the world and maybe pick up on a few little thought flaws that you might be having so that when you see the psychologist, you can hit the ground running. You've done the 101 and you've almost prepped yourself for accelerated progress.
Amazing. So you're getting people prepped before their appointments. And in terms of time commitment to this program, how many hours would they be spending working through it?
Yeah, look, we've kept it very, very short. We've got a few other programs in Australia that are 8-week masterminds and all of that. But I found that for a lot of my patients that are coming in, they've already got so much on their plate. They're looking after the kids or they've got really long work hours and they're feeling overwhelmed already. So this is a bite-sized thing that, you can achieve. It's, we recommend, you can most certainly get it over and dusted in, over the weekend, but we recommend doing it in 3 to 4 days with a time commitment of about an hour each day for the actual learning, and then maybe 30 minutes to reflect and sort of do the practical exercises to consolidate your learning. So it's a short program that's packed in with all the good stuff that we do in clinic, in day-to-day practice. This is the stuff that I've been, saying on repeat like a broken record for the past 15 years, that I wanted to give patients the 101. Like I said, in the comfort of their living room or in the car while you're waiting to pick your kiddo up from school. So it's the fact that it's online means that anyone can do it anywhere when it suits them.
Okay. And so how does it work? Do they have a consultation with you first of all?
Yeah, that's a great question, isn't it? Because it's always hard to wrangle our heads around how these new systems work. No, this is all self-directed. So effectively, you head off on our website, which is www.thecloudgp.com.au, and it's got sort of like a program description, if you will, and the person can enroll there. And you most certainly don't need a referral or a Medicare card. You don't even need a formal diagnosis. And then you work through the modules. You can sort of, download them on your phone. You can access them through your iPhone or on a computer or a tablet, and it'll just take you through each of the different modules. And so we start with things like understanding what depression and anxiety is, which I know seems like the 101 that you can look up anywhere and everywhere, but we know that patients who are informed and understand their condition really well have better health outcomes. So we start this right from the beginning. Some people see GPs and have a wonderful experience and have a really good understanding of their condition, how it came to be and what they need to do, while other people sometimes walk out of a consult feeling a little bit dismissed and confused. So we go right back to the start, explain, for those people that maybe even haven't seen a GP, we explain what the GP consult involves. We explain the symptoms of depression and anxiety, the need to rule out other medical conditions and how we kind of go along that process. And then we set up the scene to manage stigma, because that's a big thing when it comes to depression and anxiety, overcoming those limiting beliefs so that we can move forward with the practical stuff, which comes in the latter two modules in terms of, doing all the things, if you will.
That's right. I mean, I think, there's been really hard work in the background trying to get people to bring mental health to the forefront and reduce the stigma. But let's be honest, it's still definitely a massive issue, isn't it? Like, people really still struggle to admit they have a mental health problem. They're worried that it's going to impact their job or their relationship, or that in some way, particularly even in medical or allied health, people are always concerned that in some way, if they admit that they have a mental health problem, that maybe they won't be able to continue practicing, for example. So there's definitely sort of the stigma, and then there's also that hangover effect of being worried about your livelihood.
Yeah, I completely agree. Mental health is quite unique in that aspect, isn't it? We never have patients coming in feeling guilty for having appendicitis or asthma. It just doesn't happen. No one comes in with a disclaimer when they can't, feeling bad that they're not breathing well enough. They come in saying, I can't breathe, help me, or I have, severe abdominal pain, help me. While with depression and anxiety, it's often accompanied with this sense of failure and, disclaimers that they should have done this and should have done that, and the guilt and the blame. And we really have to manage those things. We can't push them to a side, because if we do, we're not going to be able to progress as quickly as what we want. So we need to tackle that head on, and we need to help people have a bit of self-compassion when it comes to their mental well-being, and understand that no one chooses to be in this situation. I think even, with cultural conversations, you hear people say, just stay positive, you'll be right, just think positive. And it's this insinuation that people choose to have depression and anxiety, and that's not the truth at all. No one chooses to be in this situation. So you're right, we have come a long way, but we've got a lot of things to do from a cultural and from an individual standpoint to try and refocus and reframe mental health to be the medical condition for which it is.
Yeah, absolutely. So we all know that Melbourne was, I think, officially the most locked down city in the world during COVID. Was that part of the thinking behind this program, or is this a sort of more post-COVID thing?
Yeah, most certainly that drove it, without a doubt. I think, that lack of social connection was a big factor in people's mental health and managing it here in Melbourne, for sure. But it's something I've had in the back of my head for a while. I've been involved with our college, the Royal Australian College of General Practitioners, and I've been, GPSN, which is a GP student network in uni. And I've always been really passionate about GP, and a constant issue that's been coming up is how we manage the increasing burden of mental health in our community. Manage the stigma, manage the fact that we have such long wait times to see psychologists and even GPs. If you go out rurally, people are waiting months on end to see a psychologist or even a GP. And the issue in that circumstance is that we don't think of depression and anxiety as something you need to move on quickly, but it actually is something we need to move on quickly, because if we let enough time go by and don't support people and keep them engaged, the overwhelm and self-doubt creeps back in. And that's the worst thing ever, because then people can disengage and sort of move away from seeking help and getting better. And then we might not see them till much further down the track when they're really unwell. So we have to come up with new ideas. But yeah, most certainly COVID played a big role in terms of that social isolation, which has a huge impact in terms of mental health outcomes.
Yeah. So the other thing I was thinking there is, as a GP and just as a mum, I often have conversations with people, and they'll tell me that they're feeling quite sad, or they're not feeling themselves, or they're feeling a bit blah, but they're always at pains to tell me, but I'm not depressed. I mean, I'm not depressed. And it's still this thing of that they feel that they're not bad enough, that they feel like to be depressed, to have a real depression, and they'll often use the word, oh, it's not chronic, as if using the word chronic means that it's more severe. And I just think that, we need to kind of get out there that actually sadness and depression do have a lot of overlap. Obviously, depressed people also feel sad, but that really, if you're having persistent feelings of sadness for probably more than about 2 weeks, it really is time to have a think that there really is something. This is more than just feeling a little bit sad or having a down day. Is that something that you've come across as well?
Most certainly. Yeah, absolutely. I think people take on this onus of needing to self-diagnose before they step into our office sometimes, don't they? And that sort of worry that things aren't bad enough and so we won't go in is a big stigma and a big thing that people struggle with in terms of presenting to us later rather than earlier. That's a part of my job to diagnose you, right? That's not your job to have to worry about whether you have clinically diagnosed depression or anxiety. That's my job. You come in, tell me what you're struggling with. I've never in my entire life of, doing medicine for 15 years ever thought to myself, gosh, that person didn't need to come in. It's always the opposite of, I wish they came in earlier. Worst case scenario, we might review you in a few weeks' time and we don't make a clinical diagnosis. That's completely fine. More often than not, by the time you come in, my gut is, something probably is up. And so, we'll go through the symptoms with you. We'll do blood tests to rule out other medical conditions. You don't need to worry about whether or not you meet criteria as such. Just come in, let's have a chat, because we've got to start looking at things from a proactive perspective.
Agree 100%. So just for everyone listening, do you mind having a little chat through what are the symptoms of, let's start with depression?
Yeah, most certainly. So it is tricky to identify, but to go through feelings of sadness, feelings of hopelessness, loss of concentration, feeling down about life. There's a medical word called anhedonia, which is about not doing the activities that you used to enjoy. So you might have loved going out to catch up with friends for coffees, and now you find yourself withdrawing and pulling back from friends. You might have enjoyed going for a bike ride, and now you just can't be bothered anymore. You could have most certainly issues with eating and wanting to overeat or sometimes undereat. It can most certainly be really fatiguing and exhausting as well. And then down the other end of it, we talk about things like suicidal ideation. So thoughts about harming yourself and not wanting to be around anymore. You don't have to have those thoughts to necessarily have depression. And the big overarching thing I think we need to talk about is whether it's impacting your life. And more often than not, it is. Depression and anxiety, we can go through the symptoms, but ultimately this is the sort of condition that permeates into relationships, into work life. So having a think about, is it affecting your relationship with your kids, with your partner, with your work colleagues? Are you performing as well as you did from a work production point of view? These are sort of questions that we explore when you come in to see us.
Yeah, absolutely. And what about anxiety? Obviously, there can be an overlap. People can have depression and anxiety, but do you mind just having a chat through for our listeners about what are the symptoms that you see with anxiety?
Yeah, of course. So anxiety, I almost call the cousin of depression, because you're absolutely right. There often is a relapse, and there's lots of different kinds of anxieties. There can be anxieties about specific phobias, but when we talk about generalized anxiety, we're talking about a general persistent worry. So a lot of the time people have sleep disturbance, which again can happen with depression as well. And that persistent worry of not being able to get on with life because you're worried about small things that maybe you didn't used to worry about before, you now get really stressed about, and it's not being able to compartmentalize. So it just takes over everything. It's very hard to get on with your day without, stressing about things that you wished you didn't have to. And then that can then, result in fatigue and exhaustion and all of that other stuff as well. So it's a mishmash of symptoms. Often when we see people tend not to fit the perfect textbook criteria. But if you're having any of those symptoms, And most certainly the big one, if it's impacting your life, so it's impacting work and relationships and your sense of happiness and inner self, then come in and have a chat.
Absolutely. And what about people who've maybe had a bereavement? They've maybe lost a loved one, they've lost a pet, or they've lost a relationship. When does grief become pathological or a problem? When is it, well, you're sad because your mum died and that's completely abnormal for you to feel like that? When does it become something that really people should be seeking further support for?
Yeah, I think that is a very, very hard question to determine as an individual, because you're often in that bubble and you can't think straight, and the grief is all consuming and it's very hard to be able to figure out. And there's no, rule about, oh, grief should be over in 2 weeks or grief should be over in 6 months. We know that it comes and it waxes and wanes. And, most certainly people going through grief can then go on to experience anxiety or depression. I would say, keep good people around you. And in the first few weeks, give yourself the time and space to be able to grieve and to take some time off work if you're able to, and connect with your friends. After a few weeks, I would say that if you find yourself unable to catch up with friends, unable to attend work, and it's having an impact again on your activities of daily living, and you're feeling not yourself, come in and have a chat. So yeah, I would give it a 2 weeks, but again, that's not a hard and fast rule. If someone's having thoughts of ending their life and it's only been a week, then I would say come in then and have a chat about it then. It's also sometimes a case where someone might be experiencing undiagnosed depression or anxiety for a few months or years before the grief occurred, and then the grief occurs on top. And so it's this sort of piling of a different events that then pushes you towards a clinical diagnosis. So it's really hard to give you a time frame, but I would, encourage you to come in sooner rather than later if you are worried. I think we all try and just be really resilient and push on with things, and to also have friends and family around you and speak to them. If you think you are, you've lost perspective and you don't know where you stand with things, have a chat to them and ask them how they think you're managing and whether they think it might be worth seeking professional help.
And if we have people listening today who maybe they're not the person feeling depressed or anxious, but it's their child or their partner or their friend, would you have any words of wisdom as to how to approach that? Because it can be challenging. Sometimes people can feel quite defensive. If you're suggesting that perhaps they're not well, they can potentially lash out or be angry. But what would you say to a family member who's worried about someone?
Yeah, look, I think that's a really beautiful scenario to discuss. First of all, well done on being such a good egg and looking out for your family member or your friend. We need more people like that in the world who are looking out for each other. So that's one, well done for that. I would think time and space, and making sure that we're approaching that discussion not from an angle of blame or criticism, but an angle of caring for someone and being concerned about them, and just asking them open-ended questions as to how they're doing, and most certainly validating how they might be feeling or what they might be doing. Your job is not to be the person that peps them up to do X, Y, Z, and I think that can sometimes cause a lot of conflict in families in terms of someone trying to push their, with the best of intentions, trying to push their agenda on someone in terms of how they think that person should manage it, rather encouraging that person to get professional help and maybe see somebody if they're open to it, and to be there as a person of support. So the door is always open for that person to come to you, to talk to you, offer to be of help, to help organize an appointment. Sometimes life is so overwhelming that it's too hard. It's too hard to look up and find a GP that you might want to see that has availability. So taking that off someone's plate and offering to do that, offering to drive them in or come into the appointment if they don't really feel like talking. To be honest, this is another reason we created the online program, the fact that it's anonymous, because I was finding a lot of patients coming in to discuss with me how they were going to manage someone, a loved one, who refused to come in to see the GP and just didn't want to come in. It's not an uncommon problem. And before we created our program, I would have to sort of just say, obviously assess them from a risk assessment and make sure that they were safe. But if they were safe, there weren't that many great options for them to start the journey at home in a comfortable space. And that's part of the reason we created the program, is for those patients that just are not ready to step into a GP's office, whether it be the guilt or the blame or the stigma, that they can do our program and hopefully start feeling better and see the value and the fact that coming in to see the GP can change things. And so I would encourage that person to seek help and be a person of validation and support. I think that's sort of the mindset that I would go into it with.
Yeah, I love that. I have to say I'm the same. I definitely see, and to be honest, I probably see a lot more women than men that I see, but it's often a female partner coming in very, very concerned, or sometimes a mother coming in very, very concerned about a male child, male adult child sometimes, but just cannot get them to come and seek help. And a family often actually in utter despair as they do not know what else to do to help that person. It's definitely, it's so anxiety provoking for the family as well, because they sort of feel at their wits' end. They're not sure what to do, and they try and make suggestions and cajole the person, and it just can be really, really challenging. So I actually love what you've done. It's absolutely fantastic. Such a great idea. Well done. I know it's anonymous, but have you been able to pull any data from behind the scenes? Like, do you know what the age of people, or is there more men than women doing the program, or is it just so anonymized that you don't know that?
Yeah, it's pretty anonymized, to be frank with you. I haven't collected data, and the reason, and down the track, maybe it's something we'll do, because it would be very interesting to see whether men were using it more than women or vice versa. But I want it to be a space where people feel very comfortable. Like, we've got lots of reflective worksheets, and PDF downloads and thinking exercises, but we don't actually collect that data. It's all stuff that you do on your computer or doing a journal at home, and very, we teach you to apply the skills to your personal circumstance, whether you're struggling with work stress or relationship issues, and coming up with those constant worries and then reframing them, for instance, or doing meditation. So for the moment, it's all very anonymous, which hopefully helps people in terms of their openness to doing the program. But yeah, I would find that very interesting, as well as down the track to see the demographic breakdown of who's more comfortable doing things online and anonymously. And also to, down the track, see they're comfortable just in seeing a GP and having hope now, and realizing the benefits of seeing a psychologist with one-to-one therapy. Because throughout the program, you'll hear me harp on about the importance of finding a great GP and finding a great psychologist and what it does. So it can most certainly be used as a motivational sort of video to help people engage with the health system. We know that I think it's 54% of people with mental illness don't seek any treatment at all. So that means for everyone we see in our clinic, there's probably someone sitting at home that's feeling too overwhelmed or too scared. So we have to start coming up with other ideas to motivate people to get that help.
I know, like myself, you're very passionate about lifestyle medicine and what lifestyle things people can change. With depression, you're sort of stuck in a catch-22 though, aren't you? Because when someone's depressed, they're not super motivated to do a lot of those lifestyle things that we know help. But can you talk a little bit about some of the lifestyle changes that we know do help mental health problems, and ones that have real clinical evidence behind them?
Yeah, absolutely. First of all, just want to acknowledge that you're absolutely right. The motivation does not hit. So this is a case of act now and think later, which is why it's so important to find, whether it's through our program or an individual clinician, find someone you trust, because you almost have to trust them blindly and do what they're saying in terms of the lifestyle interventions when you're feeling down and feeling like nothing's going to work. And then you'll find that you have that positive reinforcement when you see the benefits, and then you'll keep going on with it. But from a lifestyle perspective, yeah, look, a lot of people don't see us GPs because they're worried we're going to throw a pill at them. And that's never the case. I always talk to patients about the ladder, about how we start with lifestyle interventions and we do psychological therapies, and then we consider medication often, down the track if we need to. Most certainly there are some patients who are too unwell to engage in the lifestyle intervention, so we might consider that earlier. But yeah, lifestyle is such a big part of mental health management. We start off with things like diet, like we were speaking about before, a low carb, unprocessed foods, the Mediterranean diet, or wushuku in Japanese, which is about fresh seasonal ingredients that aren't processed. It doesn't need to be complicated. I think it's about choosing fruits and veggies that are, literally pulled out of the ground and not processed, and foods like that. From a, exercise point of view, if you're not someone that exercises, you don't need to start marathon running. I think that's the other worry people have, that we're going to go, tut, tut, you haven't done X, Y, Z. And that's not the case. It's about providing care to the individual. So if you haven't started exercising, that's fine. Maybe start with something really simple, like going for a walk around the block 2 or 3 times a week. That's it, or even twice a week. And then once you've done that for a fortnight, and we talk about this in our program in terms of goal setting and creating achievable small goals and building, do a little bit more and do a little bit more, and choose something you enjoy. If you enjoy going for a Taekwondo class at the gym with your friends and it's a social thing, then do that. If you need the quietness of bushwalking, then do that. If it's the cool water of a a swim in the pool. Find things that you enjoy. And then from a sleep hygiene point of view, I mean, that's a huge one that we could talk about all day. But, things like being aware of having a regular routine, having a little routine before you go to bed, and trying to get off our iPhones and scrolling on Insta or, your social media of choice.
Guilty.
Well, me too. Me too. And we're not all perfect. And I think that's the thing with lifestyle interventions is sometimes there's so much. You think, goodness, where do I start? I'm not eating great. I'm not exercising. I'm sleeping and my work's long hours and I don't know where to begin. So I'm just going to leave it. It's too much. And it doesn't need to be like that. What we need to do is just pick one or two very small interventions. And, I've done this with patients before and we do it in our program. And every week we tell you to add on one or two more. And you find that by the end of 3 to 6 months, you have made incredible progress. And more than the progress, you start feeling good. Your symptoms reduce. And it's this beautiful positive reinforcement where, of course, it's hard work to get up and go for a walk or make the time to get off the tram, a stop earlier and walk home. But you start doing this stuff and you feel well. And then it actually gets easier because now that it works. And then that helps the motivation build. So it is a really tricky one, lifestyle interventions, but there is so much evidence for it, so many studies, so many research articles, which is why we all harp on about it as GPs. And it doesn't need to be hard. I think that's the big thing that we have to get across.
Absolutely. Back to the sleep hygiene. So definitely the real difficulty with depression is a lot of the time people feel fatigued, they feel exhausted. Sometimes they're sleeping a lot, but actually a very big number of them are just struggling. They can't get to sleep. When they get to sleep, they keep waking back up again. They're kind of wake at 2 and 3 in the morning, feeling really anxious, but also feeling super nervous that they can't get back to sleep and they have to go to work tomorrow and they have to do this with their kids and they're completely stressed out. And so what advice do you give to people when they're sort of tossing and turning for, more than an hour in bed and they're panicking and freaking out that they're going to be so tired tomorrow? What do you get them to do?
Yeah, it's a really hard cycle to break, isn't it? Because we can talk about, the fact that poor sleep impacts depression, but depression can actually cause poor sleep as well. So it's a really tricky one to manage. I think if you are turning and tossing at night and your thoughts are going around and around your head and you've been up, for an hour or so just thinking about the same thing, get up. My advice is get up. Don't try keep sleeping and looking at that alarm clock, seeing the minutes tick-tock by until you have to get up in the work. Get up and do something that's not, don't get on your phone. That's the thing not to do. But, try and get a good book and have a read for a few pages with a bit of a warm light there and, have a little bit of a circuit breaker for 15, 30 minutes and then see if you can head back to bed after that. I think another one that I recommend to my patients, whether it's either before bed or in that situation, is a worry journal. Often there's a thought, a specific idea that goes around and around in your head that you're particularly worried about and stressed about. And we talk about, one, writing that down. And so being able to journal write that down so you can release that, but also coming up with a bit of a structural idea of how we're going to manage that problem and have that already written. So you kind of read through that, which you would have done through some of our practical psychology exercises, so that that when you're stressing about a specific problem, you can go back and go, oh, this is a regular one for me. This isn't a new one. And you can go back and look at how you plan to manage that situation in terms of steps and actions. And that in itself can be quite calming and help you realize that you've got a plan of action that's not going to destroy you and then sort of let you go back to sleep. It is a really tricky one, though, that we have to acknowledge.
Yeah, it's really hard, isn't it? One of the other things that I often say to people is, worrying about not getting enough sleep is actually just giving you another worry. I would say, not that many people have died through lack of sleep. So, try to stop panicking that you're not getting 8 hours sleep. We're going to work on it, but just try not to focus so much on it, because when it becomes a real area of focus, then it's definitely just becomes a real vicious cycle, I find.
Yeah, for sure. I mean, things like meditation can help with that as well, for sure, in terms of trying to down-regulate and stop those persistent worries and it building and building, for sure.
In collaboration with this podcast and my clinic, You by Dr. Shauna Watts, we have a challenge for you. For the month of February, it's called Leap into 2024, and this is all about your health and wellness. It's simple, it's evidence-based, it's free to join, and we've some major prizes up for grabs. So head to our Instagram for all the details. Now, let's get back to this episode. I'm actually really keen to talk to you about meditation because I know that meditation is part of your program. So I have got a very busy mind and I always think, oh, I can't do meditation because I can't ever quiet my mind enough. I also will put my hands up and admit that, of course, I'm absolutely the person who needs to do meditation for that very reason. But I'd love you to explain to me how I could begin, or how you get your the people who are following your program, how do you get them to begin meditating? And maybe if someone's listening, how could they maybe try this later today?
Yeah, beautiful. Look, I get it. It's you when you're busy and you've got so much going on, the last thing you want your GP to tell you is, hey, why don't you take another 30 minutes or 15 minutes out of your day and do nothing? It sounds counterintuitive to do that, and it sounds even more stressful. I think the point is that in our program, we don't go through anything too tricky or too confusing or too advanced. It doesn't have to start off hard. It can start off really, really easy. And I ask my patients to spend 10 to 15 minutes to begin with. And I ask them to do it without expecting any outcome. Like with anything, it takes time to have effect and to have impact. And if we're waiting for that 10 minutes of meditation to all of a sudden solve all our problems days and be able to sleep properly and everything, then it sort of messes things up, if you will. So you've got to sort of try to find a time in the day. Often before bed is a good time, but it might be in the morning for you, and have a bit of time free from distraction, which is obviously very hard for working parents as well when you've got kids running around. So try and find a time that suits. And you might look at, doing simple breathing exercises where you literally just concentrate on your breath for a small period of time and are aware of the thoughts coming in and out of your head and just try and clear your head. It might be the sort of meditation where you focus on the environment around you and become very aware of your surroundings. So look at things like smells and sights and sounds. That tends to be an easier one to start with, because the idea of clearing your head is a bit too much sometimes when you're feeling really anxious. So to start observing the environment around you for 10 to 15 minutes and, doing that and just seeing, and often by the end of 2 weeks, you will sometimes find that just that time almost gives you a bit of time to calm and feel centered, and that's a benefit in itself. And then you can work up from there. So my advice about meditation would be to not make it overly complex. You don't need to do anything for an hour or go on a retreat or do anything fancy. But the first thing would be to dedicate and try and find a bit of time to be able to do it consistently, because consistency is the key here when it comes to this sort of stuff. And to make sure that, you haven't got other people around and you haven't got your phone next to you. And then start off with simple things like observing the environment and then moving to simple breathing exercises without trying to do anything too fancy. And as people advance, then most certainly you can do more.
What are your thoughts on a family member? Obviously family members are often very worried and they really want to support and help. And let's say we have someone who's embarked on a program like yours and they're trying to do some walking, or they're trying to do their meditating or eat better. Should the family member be offering to go with them for that walk? Or if the person seems to kind of be falling off the wagon, as it were, and they've walked for a few days and then they stop doing it, should the family member be encouraging them gently? Should they be sort of doing tough love? I mean, this is the kind of question that I often get asked by family members, like, how do they approach it?
Yeah, look, it's very hard, and it's all done with the best interest of the person that you love. And you're so worried as a family member seeing someone struggle that you will do anything, and you don't know whether you need to motivate someone and push them and be their motivational coach, or whether you need to take a bit of a step back. It's very, very hard. And I think it's also tricky because different people react differently to different personalities, and it's tricky family dynamics, right? I think most certainly demonstrating that you are there and that you are always there to support them and offering to come along for a walk is a great way to start. Most certainly, we talk a lot about the fact, even in clinic, I'm sure you've seen it, where a partner will come in and say, I've tried to ask so-and-so to open up and they won't tell me what's happening and blah, blah, blah. And, I've sat them down and I've tried to get all these questions out, and the person just closes up and withdraws more and more and more from that sort of push. Sometimes most certainly doing quiet activities together. And when I say quiet, I mean not badgering anyone about wanting to know the ins and outs of their head and what's going on, gives someone the safe space to be able to open up. So I think it's a really lovely thing to be able to go for a walk, do a Zumba class together, make a meal together, and do things that aren't necessarily focused on getting all the details out on what they're thinking and how they're managing and what they're going to do about X, Y, Z, because that's all overwhelming. And sometimes people really appreciate that calm and doing another activity, and that might, in a sense, make them feel safe, and then they can open up in their own time and talk to you about X, Y, Z. It's about really creating an open dialogue. We want a relationship where if things do get rocky and someone's really struggling, they're not going to feel, that you were offended by the fact that you didn't want to go for a walk with them and they can't open up to you. So you want to just create that open dialogue with no strings attached to say, hey, I'm here. If I can be of help, let me know. If not, that's cool as well. And, encourage quiet activities so that door is always open. That's the thing with depression and anxiety, is that people sometimes feel so alone at the end that they've got no one to talk to. They feel like, despite us thinking, but I would talk to them and I would as well, this person feels so alone. So if we can create relationships where there's that open dialogue and that trust and that sense of safety, that's by far a lot more beneficial than getting all the information out.
Absolutely, I agree. And I think, sometimes it can be very easy to be the well-meaning relative who's trying to help and then ends up a bit offended that the person is sort of not thinking of your feelings or whatever. But I think you just need to have that ability to step back a little bit and say, they're actually not trying to be difficult by saying no to everything you're suggesting. I have to say, I'm a mum of 4, and I find that driving in the car is a really good way to get people actually to open up. So often have the radio on in the background, but I find that when you're not just like making really intense eye contact with someone, you're focusing on driving and they're maybe the passenger. Sometimes people are a bit more ready to kind of tell you what's going on in that situation.
Yeah, for sure. We don't always have to talk about mental health with that person either. We can talk about their music interests or what's going on for the weekend and plans. And I think that's another thing we sometimes forget as loved ones, is that we focus so much on that aspect that our conversation almost becomes centered around that, when we may have previously had beautiful conversations about common interests and such. So, feel free to talk about other things as well and let the mental health stuff creep in when it does organically.
Yeah, absolutely. So is your program got an age limit? Is it for adults only, or is it for teenagers?
Yeah, great question. It is for adults only. Most certainly I've had news of some parents doing it themselves and then using the skills to then go through things with teenagers. It gets a bit tricky with doing self-directed programs with pediatric patients when we deal with things like suicide safety and thoughts of self-harm, things like that. So that's why we haven't yet created a children-focused program, but that is my hope down the track, because we know that, with this sort of stuff, the sooner we can get into help, the better. But yeah, it is an adult program at the moment.
Okay, awesome. Well, I know that you've obviously brought up that really, challenging but real part of life, which is suicide. And it's definitely something that's becoming, or seeming to become, more common in society. And I know one of the things that even at medical school we're taught is, don't be afraid to ask the person. It's not like you're going to put that into their head. And I wonder if you could speak to that a little bit, about how people might talk to their loved one about that and ask those tricky questions.
Yeah, look, it's a very, very big topic, and we have to realize, like you said, discussing the topic does not increase the chances of it happening. If anything, you're allowing that person to open up and tell you where they're at with things. For medical point of view, whenever anyone comes in to see any of us as GPs, we do a suicide risk assessment. And that's regardless of whether the person looks like they're doing great or they look like they're really struggling, because you just can't tell with anyone where their headspace is in terms of, wanting to end their life. And often, there can be a trigger and then their head goes down those sort of lines. In our program, we've got a personalized suicide safety plan that we get you to do if you do enroll in the program. And that is for everybody. And I talk about the fact that you might not need it now, and I hope you never need it, but goodness, we want it there for a rainy day. And in that plan, a part of it is knowing what to do in a crisis situation. And well before you're in that crisis situation is to form relationships and a strategy to talk to people about it and talk to loved ones about it. So most certainly, sitting down with someone and saying, look, I know that you're struggling with depression or anxiety or whatever it may be. I just wanted to ask the question of, where you are in your head in terms of, have you had thoughts about ending your life or thoughts of suicide, and saying it quite directly. And that person might open up to you. They might have thoughts and not open up to you. There's always the chance that they keep that themselves. But the fact that you've been brave enough to have that discussion means that you've opened the door for them to approach you if they ever feel comfortable opening up. And that's the same thing in GP land. It's about creating a therapeutic relationship where someone trusts me enough to then come in whenever they need to and tell me, look, things aren't great and I've had these thoughts and I don't know what to do. And that's what it's all about. It's about creating a relationship where there is that open dialogue and respect, and that you know that you're not going to be brushed off or judged or told, hey, don't be silly, don't ever have thoughts like that, and dismissed. We want people to feel validated. So yes, most certainly bring it up. And if you are struggling to bring it up, and it's a hard conversation to have, obviously we're trained as GPs to have these sort of conversations. I think the key would be to try and find and make sure that that person is connected with a health professional that they're seeing regularly, because you can be sure that we'll be doing it and behind the closed doors of a GP office, that we'll be asking those questions. So, and then with time, we can do some joint consults where we help you with that, relationship, so you can have those discussions, but make sure that someone's connected to a GP that they trust and that they like. And ideally that's done before anyone even struggling with mental health. And I always say to patients, my friends, it's so much easier to talk about this stuff with someone that you know and trust. It's very hard when you all of a sudden develop symptoms of depression and anxiety and you're at crisis point and you want to see someone. The thought of, oh no, now I've got to go and see a clinician, and what are they going to be like, and are they going to judge me? While if you've been seeing me for years for, regular cervical screening and, back pain and rashes and immunizations and whatever else, you know who I am as a person. And I think, you've got that sense of, oh, it's just Dr. Shiromi, we know each other. She's not going to judge me. She's a good sort, and I can go in and have a chat to her. So it can take time to find a good GP, but it's worth its value in gold in terms of long-term health and being able to have these discussions.
Absolutely. And I think the other thing about the question on self-harm or suicide is that it is a question that you can ask a second time. I sometimes find that even patients that I've known for years and have a great relationship with, they'll often deny it the first time, but they'll maybe make another appointment and they'll say, actually, do you remember that question you asked me 2 weeks ago? Well, actually, I have been thinking about harming myself. So, sometimes the person might say no initially, but they might open up. So just try and keep that line of communication opened up, and not to freak out if they say, yes, I have been thinking about it. It doesn't necessarily mean they're in imminent danger, but you definitely need to make steps to try and keep that person as safe as possible. And, you can even reach out to your own GP for a little bit of advice as well as to how to manage that situation. And the other thing I wanted to talk to you a little bit about was, we talked a little bit about stigma. I do feel like I worked in the UK as a GP for 10 years or more, and then I've worked in Australia for 10 years, and I know that we can be frustrated here at the amount of psychology there is, but believe you me, there's dramatically more psychology availability than there is in the UK, where it is extremely challenging. But the thing that I still find is there's definitely a stigma about seeing a psychologist as well. And I have some fantastic relationships with local psychologists. I think they're amazing. I do think your psychologist is someone that you do need to gel with, because it's all obviously about relationships. But what do you think about the fact there's still such a stigma, or people will keep saying things like, oh, I've got a good friend, or I'm close to my sister and I tell her everything. But I just feel personally that we never tell our families or friends the whole truth, because we're always worried that we're going to worry them, or we're going to scare them, or we're going to make them upset, or that they're going to feel cross at us, or they're going to be frustrated at us. And I believe that, to be honest, pretty much everyone would value from seeing a psychologist. But do you still find that you have that stigma with some of your patients?
Yeah, for sure. I'm glad you brought up the example, because as you were speaking, I was going to bring up the same example of someone saying, oh, I'm good. I've got some good mates, or I've got some girlfriends I catch up with for coffee, so I'm good, doc. And I have to go to them, hey, listen, do you think someone went to uni for 5 years to learn, good coffee chat and up their coffee chat game? Or, that's not what their psychologists are there for. To begin with, I'm really happy that you've got those relationships where you do talk to your family or your friends or your mates, and that you feel like you can open up to them. That is so important when it comes to your mental health and well-being. So that part of me is very happy to hear that. I suppose it's important to acknowledge, one, as you mentioned, you may not open up about the really vulnerable details when it comes to your mental health to those loved ones, because often a big concern for someone is, I don't want to be a burden to them. I don't want them stressing about me. And so you may limit things in that sense. The other thing is that person is, unless they're a psychologist, and even if so, you shouldn't be treating family, they are trained to help you reframe the way you think and to challenge you. They're there to listen and for you to have a vent to, which is great. But any advice that they're offering is often from personal experience. Well, when I felt like this, I did this, this, and this, and this. And that's helpful, but it's not the evidence-based therapy that psychotherapy offers. If we look at cognitive behavioral therapy, we really dissect how you think as a person and why you think the way that you do. We all think the way that we do due to a lifetime of different circumstances, of cultural upbringing, of experiences. And, often when patients go to see a psychologist, they might come back for a review and be really confused about why their psychologist is asking about their parents' divorce or their childhood, when actually they want to sort out the here and now. And the reason for that is our previous experiences and relationships actually form how we think in life. And a lot of the time, those thoughts are really helpful. They're protective, but sometimes they're flawed and they, don't help us see the world in a very good place. And they can sometimes cause a lot of drama. So it's about looking at why, thinking about why we feel the way that we do, identifying our behaviors that result from those feelings, and then changing and reframing the way that we think. Now, that's a really tricky thing to be able to do, and probably not something your sister is doing with you when you're having a casual chat at a cafe about, whatever it may be. So seeing a psychologist is very, very different to talking to a friend. They're both needed, but we've got good evidence for doing, psychological therapies to improve symptoms of depression and anxiety. So that's why we refer you as GPs, not because we don't think you don't have any friends or any mates that you can talk to.
Absolutely. You've nailed it. And another group that I see a lot of are menopausal women who've never had mental health problems in their whole life. And they feel like just suddenly they are extremely anxious, or their mood feels very flat and they're feeling very disconnected from everyone around them. Is that a group of women that you also are seeing a lot of?
Yeah, most certainly. And it can be very hard to distinguish, like, which bit is the depression and anxiety and which one is the hormonal changes and the point is that, we know with managing perimenopause and menopause, we've got to look at it from a really holistic point of view. So seeing a psychologist and getting sort of a holistic plan of management to manage it from a diet point of view and an exercise point of view and a sleep point of view, and to improve meditation and to see a psychologist. It's hard because you don't want to have to do all the things, but that's kind of how we have to manage these conditions. We have to do all the things and doing a little bit of everything. So yeah, that's most certainly a demographic that often present. I think that demographic is pretty good at being quite honest and upfront with us from a presentation point of view, which is very helpful to us, that they do tend to come in a little bit earlier with their symptoms. I think that's sort of changed in the last few years, which is really positive to hear, because if we know about it as GPs, we can help. That's the short of it. But if we don't know about these things, it's very hard for us to help you in terms of long-term management plans.
And sorry, just going back to your online program, is that something that patients pay for privately, or is it funded through their private health fund, or how does that work?
Yeah, of course. So at the moment, it's privately funded. You don't need a Medicare card. You literally type in credit card details onto the website yourself. There's no Medicare rebate for it or anything like that. And the reason for that is that we don't need a referral to utilize it. So it is open to anyone as a one-off payment. And people go on there, and then, once you pay for it, you get the program access straight away and you can start doing it.
And is it lifetime access, or how long do they have to complete it?
Yeah, great question. So at the moment, it's 60-day access. You do not need 60 days, and I will send you an email if I think you're being a slacker because it should be done in a few days. It's just there because I don't want people to feel like they have to, they're under a short time frame to get it completed. But like I said, this program should be done within, a week. So ideally, we're getting patients that are there that want to take action, and they sign up and they schedule, an hour per day for 3 days to do the program. And that's all that they need. The extended time frame is just there so that people feel comfortable in knowing that if something happens this week, they've got access the week after and the week after that and the week after that.
Yeah, amazing. Like, I absolutely love what you've done, because I think there is that really difficult period where someone has plucked up the courage to come and see the GP. They've told us all the things. They've been sent off to have their blood test. They've gone out with their referral to see the psychologist. And then, what happens, certainly where we live, is it's a bit of a phone around, and it might be, 3 weeks, 4 weeks, 5 weeks, 6 weeks, just depending on the psychologist they want to see. And I think for a lot of people, that's, they're kind of like, but I've plucked up the courage to come and see someone now, and I kind of can't feel like I can't wait. So I feel like what you've created is actually such an incredible stopgap for them, to keep them in that holding pattern and moving forward, rather than feeling now, oh, well, I was really brave and I went to see the GP and I told the truth, and now I just have to wait for another 6 weeks for someone to help me. So I actually think that was very clever.
Thanks so much. Yeah, it's a punch in the guts. Like, it's a punch in the guts to take all that courage and bravery and see a GP and open up and do all the paperwork and answer all the questions, and then to find that you're now unsupported for a few weeks. And like I said, the self-doubt and overwhelm creeps back. And, as a GP, I'm sure you felt it before. It breaks our heart when someone has come in, they're at crisis point, and we can't offer them more help. So this is most certainly a program to fill in that stepping stone time frame between seeing a GP, being diagnosed, and jumping in there and doing the things and getting the work done. It's practical. It's not philosophical or theoretical or anything like that at all. It's the practical GP stuff that we talk to our patients about every day. And we're very big on compassionate self-care. It's about you reframing the story to realize that none of this is your fault, and to give you hope and realize that there's so much that we can do together to get you better. And, it's why I love mental health. Depression and anxiety permeate into every aspect of our lives, like we spoke about before. So to see someone at the 6-month mark and to see their life be better, whether it be they're connecting with their partner and they're going on date nights, or they've connected with their kids and they're, helping them with their homework now and having less arguments, and to see that they're enjoying, getting back to doing art or going for their bike ride. That's why I did medicine, right? Is to improve people's lives. And this is such a simple intervention that we can do to help people get back on a track and make the most of their life. So it's a really special project for me, because it's, I see it every day at work, and I realize that, there's only one consult when we do that, and we can only, see one person at a time. But by making the program online, you're literally having a consult with me, in your time and space. And that might mean at 2 a.m. on a Thursday night. That's completely fine. That might mean in the car while you're, dropping your kids off just afterwards, or, in your work lunch break. But we have to make things more accessible. So it's a real passion area of mine, if you will.
Yeah, absolutely. I want to tell the listeners one other thing that I found really interesting. I was talking to a lady the other day, and we were sitting actually watching a kids basketball game, and she was just chatting to me a little bit, and she mentioned that she had gone with her teenage son to get some support for mental health, and she was quite frustrated that the GP had asked them to go and have some blood tests. I thought it was a really good opportunity just to explain that she was sort of thinking that the GP was like stalling, and I was trying to explain that it's a really valid, it's actually a very thorough thing to do, because there are some physical problems that could be making this worse. So you could have a thyroid issue, you could be iron deficient, you could be B12 and folate deficient, you could be vitamin D deficient. All of these things can impact on your mood. And there could be another disease process completely going on that's making you tired or have no motivation or energy. So I thought that was just really interesting that she hadn't quite understood that. And of course, it's easy for us to understand as doctors, but I think what people need to understand is we're not stalling or trying to buy ourselves time. We actually just want to be really super thorough.
Yeah, for sure. And look, we go through all of that in the program. And look, a bit of that is on us as GPs. I think now we've got so much to deal with in terms of lack of resources, and, people come in with often a shopping list of things to try and sort out in their GP appointment. And in an attempt to try and get the ball rolling and deal with as much as we can in that appointment for that person, things like explaining why we're doing a blood test and what we're looking for, and all of that can be replaced by giving someone a pathology sheet and not really explaining the process. And the same goes for psychotherapy, where people don't understand, like I was saying before, why they're being asked about their childhood or their parents' divorce. And so that's the benefit of doing an online self-directed program, where we can go through, and in the program, we specifically go through and explain a few of the blood tests that GPs, a comprehensive GP will likely order, including thyroid and iron and B12, and they're going to ask questions about your diet and your exercise and your sleep, and it's smoking or vaping. And it's not because we're nosy, it's because we've got to create a holistic management plan for you moving forward. So helping patients understand the medical workup in terms of how their GPs are going to approach that consult, and also understand where their psychologists are coming from when they start therapy, and to understand that, therapy does take time. You're not going to walk into one appointment and come out and be all new and fantastic. Setting expectations is really, an important part of the therapeutic relationship that gets left out sometimes. So it's good to have those discussions ahead of time and talk. And I'm glad that, your friend can now understand all of that, because that's a big part of understanding and trusting your GP.
Yeah, absolutely. I could talk to you all day. There's so many other things that we could talk about, but you have been so generous with your time. I would like to just ask you one final question. If there was a piece of advice you could give your 20-something self, what would that piece of advice be?
Yeah, that's a good question. I think it would be to invest time and energy in creating really good relationships, really good, surrounding yourself with good eggs. If I think back to myself when I was in my 20s, I was, halfway through my university degree and then into internship. And the friends that I formed there are friends that I've had for life, and we've encouraged each other and helped each other through the ups and downs, that, the curveballs that have been thrown at us in our 30s maybe. And so creating an environment around you of people who uplift you, who encourage you and love you, and you have that dynamic bilateral relationship where you help them as well. It helps with mental health, but it helps with life in general to have a good, good people around you. So that would be my advice, is to surround yourself with good egg people.
Amazing. I agree 100%. Thank you so much. You've been so helpful. Is there anything else that you feel that we haven't talked about, or you'd like to share any other nuggets with us?
Yeah, of course. I might just direct your lovely listeners to our, and we'll put the link in the show notes, but our free resources that we have on our website, because most certainly, if you want to enroll in our course, you most certainly can, but we've got lots of other resources to help you. There's a support directory on there for Australians, most certainly if you're struggling with your mental health. And there's some great resources on there that you can download to help prepare for that GP consult. So we were talking about before about, what your GP is likely going to ask in a mental health consult, where they're going to ask about symptoms and physical aspects and blood tests and social aspects and goal setting and all of that. And I think, one of the things that we get scared about when we go to see the GP is we don't know what they're going to ask. And that in itself can just feel a bit overwhelming. So if I can give you the one-on-one on what we're all likely to ask in a GP consult, it gives you a bit of prep time so you don't feel like a bunny in the headlights when you get into that office. So maybe we can pop the download link on the show notes, and we can share that with people so that they've got that free resource so that they...
Thank you so much. That's so generous. All right. Thank you.
Thanks so much. You have a lovely day.
If you enjoyed this episode, I'd really love you to leave a review or share with someone who you believe would benefit from hearing this conversation. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.